Welcome to the first lecture of week 3 in the VBP educational program. This will cover the theoretical knowledge that you need for week 3 regarding lifestyle modifications in diabetes mellitus. Basically, this will be a recap of diabetes management including lifestyle modifications. Diabetes mellitus is a metabolic disorder of multiple etiology. The disease is characterized by chronic hyperglycemia with disturbances of carbohydrate, fat, and protein metabolism resulting from defects in insulin secretion, insulin action, or both. There are types of diabetes. These are some of the categories: type 1 diabetes, type 2 diabetes, gestational diabetes mellitus, and specific types of diabetes. So let's look at one by one. So type 1 diabetes, this happens due to absolute deficiency of insulin due to pancreatic beta cell dysfunction. And type 2 diabetes accounts for 90 to 95% of all diabetic patients, and this happens due to relative insulin deficiency along with insulin resistance. And GDM or gestational diabetes mellitus usually diagnosed in the second or third trimester of pregnancy. And specific types of diabetes are kind of MODY or monogenic diabetes syndrome, and diseases that involve the exocrine function of pancreas, for example cystic fibrosis and chronic pancreatitis, and drug-induced diabetes. This figure shows the glucose homeostasis, and this red color indicates what happens when the blood glucose level is increased, and the green color indicates what happens when the blood glucose level is reduced. When the blood glucose levels are increased, it will promote the insulin secretion from the pancreas, which will increase the glucose uptake from the tissue cells, and also which stimulates the glycogen formation. So the glucose is converted to glycogen. Likewise, the blood glucose level will be reduced. When the blood glucose levels are reduced, it will promote the glucagon secretion from the pancreas, and when the glucagon is secreted, it will stimulate the glycogen breakdown from the pancreas. So the glycogen is converted to glucose. Likewise, it will increase the blood sugar levels. This is the pathophysiology of diabetes mellitus. So diabetes mellitus happens due to two reasons, that is insulin resistance and decreased insulin secretion. So due to these two reasons, there will be relative insulin insufficiency, which ultimately causes development of type 2 diabetes. There are environmental factors which cause insulin resistance like obesity, diet, and physical inactivity. And the genetic factors cause both insulin resistance and decreased insulin secretion. Now let us look at the modifiable and non-modifiable risk factors for diabetes. So the modifiable risk factors will be physical inactivity, overweight or obesity, and poor dietary habits, hypertension, smoking, and certain medications like glucocorticoids. And non-modifiable risk factors are genetics, family history, race or ethnicity, increased age, and history of gestational diabetes. Now let's see how patients will present to you with diabetes. So the presentation may be acute, subacute, or asymptomatic. Usually in acute presentation, the patients are young and they will have a history of 2 to 6 weeks with classic triad of polyuria, thirst, and weight loss. And some may present with ketoacidosis. And in subacute presentation, the patients are older and the onset might be months to years with the classic triad of symptoms and may present with symptoms like lack of energy, visual blurring, and pruritus vulva and balanitis. And asymptomatic patients are usually detected on routine clinical examinations with glycosuria or raised blood glucose level. Now let us look at the clinical examination of a diabetic patient. So you have to check the parameters like height and weight and BMI to check whether they are overweight or obese, and blood pressure, fundoscopic examination, skin for acanthosis nigricans and insulin injection sites and lipodystrophy can be noted, and comprehensive food examination with visual inspection for skin integrity, callus formation, any food deformities and ulcers, and screen for distal ulcers, and also sensations like temperature, vibration, and pinprick sensations will be needed. These are some of the clinical examination findings you might see in your patients. This is a picture of a background retinopathy, and this is proliferative retinopathy, and this is a picture of a neuropathic ulcer, and this is lipodystrophy, and this is how you have to check for pinprick sensation and vibration sensation. These are the investigations that you need to do in diabetic patients. So first we look at the diagnostic tests. They are fasting plasma glucose, random plasma glucose, and HbA1c. So for fasting blood glucose, you have to keep the patient fasting for 8 to 12 hours. And then for random plasma glucose, this is for diagnosis of diabetic patients who are symptomatic patients with hyperglycemia. And HbA1c is used to predict the long-term control of diabetes around past 1 to 2 months. And the other investigations that are needed are urine for protein, full blood count, blood urea and serum electrolyte, liver biochemistry, and random lipids. These are the diagnostic criteria for diabetes. So fasting plasma glucose should be more than 126, and 2-hour plasma glucose is more than 200, which is done in oral glucose tolerance test or OGTT, and HbA1c more than 6.5. And in patients with classic symptoms of hyperglycemia or hyperglycemic crisis, a random plasma glucose more than 200 is also considered as diagnostic. So now we'll talk about the management of diabetes. So there are 4 main goals of management of type 2 diabetes mellitus. They are lifestyle modification and patient education, maintenance of good glycemic control, and multiple risk factor management and prevention of complications. Lifestyle modification is the key foundation for the better management of diabetes. Patient education is an essential continuous process to facilitate patients' knowledge, skills, and ability necessary for self-diabetes care. So for lifestyle modification, we have to offer medical nutritional therapy, and we have to advise the patients to increase their physical activity and to avoid smoking and alcohol. So today we will discuss more about this part in the next few slides. And then regarding the maintenance of good glycemic control, this is basically done by pharmacological management. We have to select the best drugs for individual patients from the drugs that we can give for the diabetes mellitus patients. So these are some of the drugs which can be used in diabetes mellitus. And then the next goal is multiple risk factor management. So apart from diabetes mellitus, we have to manage dyslipidemia, hypertension, and cardiovascular diseases such as myocardial infarction, stroke, and transient ischemic attacks. And prevention of complications, there are two main complications, microvascular complications and macrovascular complications. In microvascular complications, there are three main components: retinopathy, nephropathy and neuropathy. Macrovascular complications are stroke, peripheral arterial disease and coronary artery disease. So diabetes mellitus is a huge disease. We have to think of all these four categories when managing our patient. Before going into the lifestyle modification part, we need to know about some concepts. One concept is about calories. So calorie is defined as the amount of energy needed to increase the temperature of gram of water by 1 Celsius. So simply, calorie is a unit of measure which indicates the amount of energy contained in food. So this is needed when we are advising patients regarding dietary intake. So when we consider weight loss, if our energy expenditure is more than energy intake, then we will be able to lose weight, and we will be able to maintain weight if our energy expenditure balances the energy intake, and weight gain will happen when our energy intake is more than energy expenditure. Then we need to know about the calorie requirement of an individual. So this depends on age, sex, height and weight and the level of physical activity. So these are some of the online tools that we can measure the calorie intake we needed. So we can use this kind of softwares to calculate the calorie intake we need to take to weight loss or maintain or weight gain. So when we calculate for average people, so average daily requirement to maintain weight in males is around 2000 to 3000 kilocalories per day, and for females it's 1000 to 2400 kilocalories per day. So when we have patients, we have to calculate the daily calorie intake of patients, and then we have to advise them regarding the diet they need to perform to lose weight if they are obese or overweight. As we discussed earlier, the calories in a certain food item is important, and also we need to think of the glycemic index of certain food categories. So glycemic index is a rating system for foods containing carbohydrates. It shows how quickly each food affects your blood glucose levels when that food is eaten on its own. So there are certain food items with high glycemic index and low glycemic index. So we need to advise the patients to consume this kind of low glycemic index foods, which is important in the management of their blood glucose level. This chart shows you the glycemic index of commonly consumed food items. So these foods contain high glycemic index, like foods like white bread, white rice, donuts, rice cakes, noodles, Coca-Cola, popcorn. These items have a very high glycemic index, whereas food items like bananas, white corn, peanuts, sweet potatoes, apples, milk, tomatoes, green tea and brown rice has low glycemic index. So when you are taking the food history of patients, it is important that you highlight the need to consume more food items which contains low glycemic index. Now we will talk about carbohydrate intake. So when we are talking about the carbohydrates, we should encourage the high fiber, low glycemic index foods. The main categories would be fruits, vegetables and whole grains and pulses. And we have to discourage the sugar sweetened beverages like fruit juices and processed food products with high amounts of refined grains, and we should discourage the usage of added sugar. Regarding the daily level of protein intake, it should be 1 to 1.5 gram per kilogram per body weight per day. So it is between 15 to 20% of total calories. So if the patient has diabetic kidney disease, you have to limit the protein intake to 0.8 gram per kilogram per body weight per day. So you have to calculate these values according to your patients if you are managing their diet. Then we will look at the fat intake. So fat intake should be 25 to 30% of total energy expenditure. And we should advise our patient to reduce saturated fats like high fat meats and cheese, and also to reduce the intake of trans fats which are in processed foods, baked goods and fast foods. And we should encourage the intake of low fat dairy products and lean meat, and also limit fat to oil in cooking and fried foods, processed meats and high fat snacks. Having said every detail about glycemic index and calories, there should be a simple and understandable way to advise patients regarding the amounts of food categories that should be taken in a meal. Plate method is one of the ways to explain this. So in the plate method, quarter of the plate can be filled with starchy foods like grains and starchy vegetables. If we think of Sri Lankans, this can be filled with rice or some starchy vegetables, and the other quarter can be filled with lean proteins, and half of the plate can be filled with non-starchy vegetables. So you can use this plate method to advise your patients regarding the diet that they should be taken. So these are the recommendations for physical exercises in diabetic patients according to the clinical guidelines. So you can advise to have moderate intensity or moderate to vigorous intensity aerobic physical activities like walking, cycling and swimming at least 150 minutes per week, and for obese patients at least 60 minutes a day of exercises. And also resistance training can be advised, exercises like push-ups and dumbbells at least 2 to 3 sessions a week. And also you can encourage the muscle strengthening activities that involve all major muscle groups, the exercises such as yoga and tai chi, 2 to 3 sessions per week. So these are the physical exercises you should encourage in diabetic patients. This brings to the end of this lecture, and thank you very much for joining us today, and we will see you in the online lectures.